Well, great, everyone. Well, welcome. Good afternoon. Good morning. I'd like to welcome you by saying if you can introduce yourself and where you're zooming in from in the chat box. I'm sure we're going to have more people, and we also will be recording this so that we can share it widely. My name is Lisa Hilme, Executive Director of Core Group. And Core Group is a membership organization and network with over 25,000 global health practitioners who are implementers in cross-sectoral, community-based approaches, both in development and humanitarian settings. We've hosted the Global Health Practitioner Conference since 1997, workshops and other convenings, and we have technical working groups that spur collaboration and learning. Feel free to join those and learn more about Core Group on our website, which is coregroup.org. It will also show some of our programs that we implement, how you can be involved in the programs, how we connect members to larger initiatives and provide global health leadership to ministries of health, WHO, Gavi, and others from civil society and community-based approaches. And we'd like to thank you for joining us today. We know there are many competing initiatives. To hear about three amazing initiatives with their leaders and mentors that won the Pitch Challenge at Core Group's Global Health Practitioner Conference in Nairobi, Kenya in October 2024. Since 2017, Core Group has sponsored the Pitch Challenge at our Global Health Practitioner Conference, providing cash grants and mentorship to advance these social enterprises and health initiatives. We saw the value in those innovative, community-based ideas and investing seed money, as well as connecting the teams with technical experts. We have had a broad range of community-based maternal, child, and adolescent health, nutrition, reproductive health, and inclusive disability health issues that have been addressed over the years. From this webinar, we hope you'll connect with teams, learn more about how these community-based approaches can make a difference in advancing health, and catalyze ideas for your own organizations to advance your initiatives. We will announce the next round for the community health, the Core Group Pitch Challenge at our next Global Health Practitioner Conference and by June of this year. So sign up for the Community Health Listserv from Core Group. Kate will drop the link in the chat box and look at what other offerings we have at Core Group. I'm a little sick today, so I hope you can hear me. And I just got off a plane last night, so thank you for your patience. Now for what we've been waiting for. I'm very, very excited to thank the incredible teams and mentors that have advanced these incredible initiatives. We have Diversity Innovations Initiative from Uganda. It's a diversity health app, and it's led by Rebecca Nankinga and Joseph Akoli, with mentor Marie-Ange Jou from Humanity and Inclusion. We will also hear from Kuhenza, based in Kenya, a child case management mobile application, led by Lucky Mahenzo and Thomas Kalume, with mentor Chika Offer from Vaccine Network for Disease Control, and Strong Enough Girls Empowerment Initiative in Nigeria, an indigenous podcast series led by Queen Ugureru and Emilia Adejumoke, and mentor Khadija Karma, who's an independent health expert, formerly with Catholic Relief Services. I'd also like to thank Kate Kabori, Core Group Communication and Advocacy Lead, who's been working closely with the teams over the past year. So in the next hour, we're going to have the teams explain their incredible initiatives And our first team that will be up is Diversity Innovation Initiative. And I would like also the sign language interpreter, if you can please introduce yourself, since you'll be helping with the translation today. So at this time, I'd like to turn it over to Rebecca and Joseph from Uganda Diversity Innovations Initiative. Thank you. Over to you.
Good afternoon, ladies and gentlemen.
And if we can please augment the volume, maybe we can't hear you. Yeah.
Good afternoon, ladies and gentlemen. I'm called Bumba Brian Elijah, and I'm a sign language interpreter. I'm going to be supporting Joseph and Rebecca here. Thank you. Okay, good afternoon, ladies and gentlemen, and good morning from wherever you are. I'm by the names of our colleague, Joseph. I'm the team leader at Diversity Innovation Initiative. And my colleague here is going to introduce herself. And we are here with our mentor, Marie. Yes. We are very happy to be part of this important group and this important meeting too. And we want to thank Core Group for partnering with us and also supporting us to get us a mentor, who's Marie from HR. She has been very, very, very helpful to us and to see that we have been able to achieve. We are looking forward that maybe we can proceed working with her. Yes. Okay, first of all, I would love to give you a brief introduction about DIV. It's a social enterprise which is using digital technology or innovations to support or to improve the lives of persons with disabilities. And to see that we have equity in our societies. And our vision is looking at making sure that a society of persons with disabilities who are empowered and who can be able to perform. Many women and men have got different projects that have to do with health. However, for this particular project, it is being inclusive in Uganda to ensure that there is full accessibility to sexual reproductive health information through sign language, and to ensure that there is a friendly services. There are friendly services that are being offered to persons with hearing impairments. And this innovation is providing access to friendly information to persons who are using sign language. And this innovation also offers a verified solution that can easily be understood and are independent. And it comprises of different sign languages. We have got Ugandan Sign Language. We have also added Congolese Sign Language, Why? Because the innovation is trying to support other individuals who are refugees who have come here in Uganda. And also this innovation, the innovation facilitates accessibility to health workers and to GBV survivors. Those are gender-based violence survivors who will need sign language services. And this innovation also, it is a digital interactive tool whereby you can interact with the counselors about sexual reproductive health to get support. And our implementation, the experience we have got there, what we have got, what has really happened well and what has not gone well. What we have done well, our project has been able to increase awareness on the youth who are living with disabilities about sexual reproductive health. Secondly, the project has also empowered and has enabled these individuals to access easily these SRHR information. Because of the support that the project has been offered and the mentorship we have got good experience of Marie, who's here at HI, who has been supporting us highly to see that we can push. And this mentorship has really supported us, whereby we have even been able to get some consultancy trainings to health workers in Nachivali refugee settlement, where we trained health workers in sign language. And we have been also doing a number of trainings, camps, whereby also Maria has attended some of them, and also we have been able to interact with core group members with the support of Maria, of course, and different managers whom we have trained at a national level, at the ministerial level, and at the NGO levels. And also we have been able to go ahead and train the Belgian embassy we have interacted with them on the same matters. But however, we have got some challenges. So we have managed to come up with a few videos as part of our work plans. And these videos have been disseminated to young deaf individuals to see those ones who really highly need these services. And we have been able to disseminate them. But the challenge is that the coverage has not been enough, because they have been asking us, where are more videos? Where are more videos? And so we need to make more videos to ensure that we cover the various topics. And also we had the 1 month health training, but we built their capacities. However, these health workers really need more support, because like the time which was given wasn't enough, and we think that for them to benefit in the future, we need to increase the time to ensure that they can be able to comprehend this information. Yeah. And there is another challenge whereby deaf refugees who are not capacitated with the knowledge of sexual reproductive health. And so it's been challenging in a way that the project can't run programs in the refugee settlements, because there are ups and downs that really are there. And also some resources which require but yet there are a number of these deaf individuals in the refugee settlements who are undergoing sexual matters. And we have also got some achievements. With Cohort Group, we have been able to manage to upgrade our diversity app. And also we have included our app on iOS, whereby those people who are using Apple phones or iPhones are able to access this information. And also we have been able to train health workers basic signs, and they have been able to get the skill of communicating, and they can deliver some services to patients who are having hearing impairments. And we have also come up with 7 digital learning videos, which we have also disseminated. We have also had around 3 meetings with youth to build their capacities, and also to get feedback from them on how the app is, or how the innovation is working out, and to ask them about the content, how they find the content. The other benefit is our mentor, Marie, with the various technicality and experience she has got, she has been able to guide us through to get into the refugee settlement. Initially, we had issues. We couldn't really even penetrate through. But from the time we got the mentor, who's Marie, we were able to penetrate and get there. Yes. And then we have the key lessons. First of all, mentorship has been very, very, very important to us, and it has helped us to succeed in our program. We have learned a lot, and this is what I can call for. It is, we have more of this to build us, to grow us. This is very important, because we keep learning from this. It's a very critical area where we as youth who are growing, we are able to learn and get guidance, and our knowledge grows. And also, as you may know, that in the area of inclusivity, this knowledge is really very important for us. And the other thing is to do with collaboration. We have learned that collaborating is very good, and it is helpful in a way that it helps you work easily and even deliver easily, such as working with HI. Work has been very easy for us to deliver. Lastly, multi-language approach. It is a very good one. It is an approach whereby it promotes inclusivity, and it doesn't leave anyone behind. It establishes a place where individuals who are let's say, who are Congolese and who are Ugandans come together and are able to learn and understand each other. And so we look at the next steps. The first step is we try to improve on the app. Yes, so basically we have got the feedback from the number of individuals who are using it. And we want to ensure that the content is kept well, and also to ensure that we are effective in delivering continuously. So we are looking at how to come up with content that is offline, whereby we can come up with hotspots where users who don't have access to smartphones or or who can access services digitally anywhere. For instance, there are people who are in refugee camps who may not have, let's say, smartphones, or they don't have internet. When they have, let's say, they are offline, they can easily access this. We are also looking at scaling it up and disseminating it. There is a lot of work here because we need to do comprehensive sexuality education. And this is to make sure that most of the individuals, even the refugees, are able to benefit from our work. So initially we had done videos in Ugandan sign language, and now we learned that we needed to include the refugees who are Congolese, and now we have started moving to refugees who are Sudanese also. And also, we want to scale up these sign language training programs to make sure that health workers, wherever they are able to use sign language to communicate. Let's say, even when they are partnering with HI in giving health services, wherever they are, let's say in Nachivali, they can be able to deliver. You know, Uganda is big, so this requires us to have support. So we need to build the capacity of these individuals, and also the individuals who are refugees, basically, in Uganda, to ensure that they can be able to access this information. We want also to strengthen the digital engagements. Lastly, we want to embed other relevant departments of health in the project to see that we can change their attitudes. And let's say we have departments of communicable diseases that can really work together with us.
Can we wrap it this part up and then we'll go to Marie-Ange? But also I'd like Joseph and Rebecca to show themselves and introduce themselves. Let's finish up. Yeah.
Joseph is summarizing. For sustainability purposes, we are looking at working together with the government hospitals to ensure that we continue providing them with these technologies, with this information. And also our organization is looking at working socially with individuals and other partners for sustainability. And that's all I have. Thank you so much. My apologies, it's been long. You know, sign language, the interpreter, and the signer. That's where we are. Thank you.
Absolutely. We thank you for that. And can we have Joseph and Rebecca come on the camera so we can see them? And then we turn it over to Marie-Ange for her reflections as the mentor. And we're still seeing the slides. I don't know if Marie-Ange has slides or. Ah, wonderful. Please introduce yourselves, Rebecca and Joseph.
I greet you once again. By the names of Akoli Joseph. My sign name is that right in the chest. I'm called Olivia. Rebecca, and I work with diversity innovation initiatives. Thank you.
Thank you, Olivia, Rebecca, and Akoli Joseph. Marie-Ange, do you have some reflections as mentor for this incredible group?
Thank you very much. I won't take longer because I think it's most important to hear about our wonderful partners. No, I just want to, in 2 words, to really share my appreciation to the core groups, because I work for an organization which is called Humanity and Inclusion. It used to be named Handicap International, and actually I live and worked in Uganda, and without core group, I would have maybe never met Rebecca and Joseph. And it's a bit of it would have been definitely a big pity. So it gave us really time to understand each other. It gave us the opportunity to grow together. I try as much as possible to bring my experience into our conversation and strategy for this year. And they brought me so many intels about communication. So it was really like a win-win situation. It was a very rich year where we could have bring quite some visibility for the DIV organization, and I'm very happy about that. And I think it started as 1 year mentorship between the DIV group and me as an individual, but definitely now the DIV organization and HI and more NGO are going to keep on working. So speaking about sustainability, I think it's a very good and important point. And again, thanks a lot to the core group for making it happen. Thank you.
Thank you, Marie-Ange. And let's give a big congratulations. And in sign language, you can see that this is congratulations, clapping hands. And at our conference in Nairobi, we had almost 300 people doing this for Olivia, Rebecca, and Okoli Joseph. So thank you very much. Thank you. Right now, we're going to move on to our next incredible initiative, and we'll take some questions later. So put your questions and comments into the chat box. And now we will go over to Kuhenza for children in Kenya. And I'm really excited to introduce Lucky Mahenzo. If you can also come on screen, introduce yourself, and their mentor, Chika Offer from Vaccine Network for Disease Control in Nigeria. So Lucky, over to you and your incredible project.
Hi, my name is Lucky Mahenzo. I'm working for Kuhenza for the Children in Kilifi County, Kenya. My colleague will introduce himself.
Hello, everyone. My name is Thomas Katana, working with Lucky at Kuhenza for the Children in Kilifi County. Thank you.
Okay, maybe our mentor could introduce herself.
Yeah, thank you so much, Team Kuhenza. My name is Hadija Karama, everyone. I am a public health and child protection specialist. I worked for Catholic Relief Services until December, but then rejoined for a short-term, engagement. But I am very passionate about children, passionate about disability, and I love mentoring, local organizations, individuals, and my journey with Kuhenza has been amazing. So back to you, Lucky, to hear your experience with the team.
Yes, thank you. You can see our slides, okay? Okay, so when we first pitched about this idea, our goal was to ensure that we were coming up with a tool that will strengthen the engagement of community leaders in supporting children with disabilities. And through that, our project has really evolved, and it's not about just the mobile app. but we've gone further into issues of inclusion, mentorship, and ensuring that no child with a disability is left behind. And today we will just share with you what worked, what didn't work, and our next steps when it comes to our initiative. And actually, our original idea was started in 2020 when we were responding to COVID-19. And over time, we engaged over 60 users, families, developers, and students, where we've been able to refine the app logic. And the first 2 years, this had the number of children with disabilities that we were supporting had tripled. And it clearly showed that this app had a potential, even though we had not started to involve those leaders with low tech levels. So our aim with this speech challenge was for us to come up with a very user-friendly paper-based biannual check-in that is used by community leaders to reach or counsel and refer children with disability. And this was to aid those leaders in our community who, let's say, their literacy levels was a bit lower. And our main aim was also to see that we were able to strengthen the capacity of at least 50 local leaders with these low literacy levels or low tech to ensure that they effectively and efficiently counsel and refer children with disability to referral services, whether it's the hospital or for education purposes. Our proposed output initially was for us to have a refined mobile app content, user tools, and also we wanted to scale these to ensure that many other local leaders within the community are able to use it, and also to ensure that we could at least reach another 1,000 children with disabilities where we are able to manage their cases through these apps. And the mentorship approach that we had with our mentor, we had regular check-ins that included emails, videos, and such. And she really provided a lot of guidance to us as we were planning our activities together. The biannual local leader check-in that we wanted to have in paper-based, we did discuss together with our mentor, and with her rich experience, it was really helpful for us to see. I remember a question that she did ask us, are you asking questions for the sake of it? Or what is the intention of you having these questions? She also shared resources with us, tools, and also other even opportunities where we could share our ideas with other people. Why did we think we needed the paper-based? One of it was we wanted to move away from the barriers that we had, issues of internet and lack of devices and the literacy levels and also the tech skills that our leaders had. Actually, also the paper-based was to serve as an inclusive way of ensuring that we do not leave behind leaders that, let's say, they are of low literacy or maybe they are unable to work with the gadgets. And also this was to increase the credibility of our local leaders, because at least when you're seen, you're doing something with a form, it clearly shows that you're more credible than if you're without. And this was also an initiative of ensuring that we did not leave any child behind because of the tool that we were initially using, that was the mobile app. So our key areas where we really performed well was on how we developed this tool. Initially, we did sit with our mentor and we reviewed the local leader biannual check-in, and we really reduced the number of questions that we had. We pilot tested it with 6 community leaders, 3 staff, and 9 parents. They gave us their feedback. After we received the feedback, we incorporated it. And again, we pilot tested it with the same community leader, staff, and parents. And again, incorporated the ideas after the second phase of pilot testing it. And after we incorporated the last ideas, we were able to reduce our form from 141 questions to 31 questions. And in so doing, we were able to put them under 5 domains, and it was on any emergency that a child could have, health and well-being, education, protection and safety, and also psychosocial support and community belonging. So this really, it was an eye-opener for us, because what we have in the paper-based is what we have also incorporated the same in the mobile app. Also, we have seen the strengthening of relationships among community leaders and families. There has also been that build of trust amongst them. We have also seen a quicker response of emergency cases, especially where children need to get emergency medical services, because as they are closer to their families, it is easier for us to understand about the situations and how we can easily support them. This has also helped us to continue to develop the skills of our community leaders, and also making sure that we are really decentralizing the follow-up system such that it is not something that should be done again by our staff. And we were able to train 50 community leaders, and 34 of them actively used this tool. And if I can just share briefly, the first 6 months we spent the same in refining the tool. And when we got to the second phase, we also continued to refine the tool for the first 3 months. And in January, that is when we kicked off the use or the active use of this tool by our community leaders. So most of the time was used in the development of this tool. We want also to share with you the benefits of just working with the communities. And this usually is an effective model as it reduces the cost, because we are leveraging on already existing local systems to support our children with disabilities. The community leaders are already trusted by the community. So as such, it is easier for us to penetrate easily and also have children with disabilities supported. Also, it increases the service coverage that we can reach, because otherwise, with our number of staff, we would be unable to reach the many children that we to reach. And actually, it isn't the burden for most of our staff. For now, we are able to focus on maybe complex issues that need our attention. So we were also faced with what did not work so well, or things that we did not expect when we were planning for all this. And we were faced with the issue of the sustainable engagement of it, because sometimes it is not just about the trainings. When we are done, then we are faced with the fact that the community leaders continue to work, because again, they are also faced with their own other needs with their families or day-to-day activity. We were also faced with the need of making sure that we were coming up with flexible models of engagement, so that community leaders can easily drive these follow-ups on their own. And also, it has been maybe a big issue for many people, the fact that when we have the issue of financial motivation, sometimes it brings so much problems, because it becomes like they become an extension of the staff that you already have in your office. The key challenges that we also faced when we were using, there was the double data entry part of it, because again, after we use the paper-based, we want to have it also appear in the mobile app to feed in our home care website systems. We also were faced with the data security issues. These community leaders are having these papers in their hands. We are not sure in which other person's hands they would fall and how the same will be used. And when we are looking at it from the safeguarding point of view, that was a bit problematic for us. We were unable also to manage the expectations of the community and families. Families thought that their community leaders were actually receiving something out of them. And also there was the need of to process a lot of improvements, ensuring that we do a lot of sensitization amongst the community for them to understand actually what the aim we wanted to achieve for children with disabilities. Our measurable outcomes were, we were able to identify 60 new cases of children with disabilities. This came with the 34 community leaders that were actively engaged, and they were linked into different services, education, health, and the many others, including physical therapy. And also this paper-based, also because we have translated the same into the mobile app, it was also used to reach 620 existing children that are already in our systems, and they were supported through this biannual check-in. We also trained the 50 community leaders, and 34 of them were able to apply the tool effectively. And the well-being of children was improved. The 680 children received the different services that they needed, and it was easier for the community leaders to refer them. The 680 would not have otherwise received these services if we were the people in the office trying to make sure that all the children needs are identified and they are supported effectively. There was the benefit of it being a community-driven initiative, that these community leaders felt like they were the people saving lives. It also improved inclusion and also strengthened referrals for our children. The key lessons that we learned out of this was it is essential to continue working with community leaders, as they are already enshrined in the local systems. And this will increase the uptake of services for our children, and also lower the barriers that otherwise would prevent them from receiving these services. Having inclusive designs, that's being people who are able to use the mobile app and those who can use the paper-based, it also shows the inclusivity that it's not that one has to be of high literacy levels for them to support a child with a disability, but everyone can work together and achieve the common goal for our children. And also leveraging on these community leaders will also help us to continue proportionally increasing the program's impact amongst our communities, and also receiving just the feedback from communities helps us to invest in relationships and ensuring that we are able to align with the realities and needs of people in the community, not us just sitting in an office and maybe assuming that this is what is going on within the community. So our future plans are ensuring the continuity of this. We want to continue working with community leaders that are already existing in the system. A good example would be the community health promoters here in Kenya. They're already working on a health system. So if we can continue incorporating them in our area of work as they do the normal family visits, we will also ensure our children with disabilities are benefiting out of it. And in Kenya, as they are already receiving some pay, it is more sustainable for us, and it would also feed into the county's health systems. We are also focusing on increasing disability inclusion trainings for even the community health workers and also the health professionals within the county. Actually, today we had a training with the community health workers, focal persons, and other people from the county government, so that as we are able to roll out this form, they already have the knowledge about disabilities, their causes, and the intervention, and the simplest way they can even identify children with disability. We also want to help ourselves to do away with the duplicity that is already existing. We want to improve on the child safeguarding issues because of the data security issues that we have. And we want to just have a hybrid system where every leader without, let's say, high tech skills or literacy levels can also participate fully in these programs. Thank you.
Thank you so much, Lucky and Thomas. And I really thank all of the teams for such honesty and just sharing all these lessons learned, all the challenges, all the incredible community lessons. I mean, we learned so much from you. And so I just want to thank you for this. We know that starting up something isn't always easy, scaling it, and it takes time. So Khadija, the mentor for Kuhenza, and again, I'm blaming my illness and jet lag on my confusion before. Khadija, thank you very much for all of your mentorship for Kuhenza for the children. What are your reflections over this time?
Yeah, thank you so much, Alisa, first of all, for the opportunity to, become a mentor. It's, as Rebecca mentioned in that presentation, it's a two-way relationship, and we both benefit. The mentors benefit, and the organization who are being mentored benefited. So I equally benefited from this relationship, and really looking forward to any future opportunities to mentor other organizations. So when we started off, for me, it was like, how is it going to look like? Kuhenza is in a different county and I'm in a different county. If you're to take the bus, you would spend like around 8 hours to get to, actually more than 8 hours to get to Kilifi. But then thanks to technology, actually all of our work was virtually done. So it started for me, it was more than just checking in as a modality for mentor-mentee relationship, but it went through beyond to becoming a co-creation kind of mentorship, where we co-created as a team, and that co-creation really translated for Kuhenza to co-create with the community leaders. So for me, that really stood out as one of the things where Kuhenza as an organization went ahead and co-created with the community leaders. They got the validation, and it really worked so well for them. One of the things that I picked up is that, for you to ensure that there is sustainability, then we need to enhance and empower the community-based, structures that are available there. And for me, I have a passion on localization, local leadership. So I've seen that, happening with Kuhenza. They are local organization. We have local problems. They've worked with the community structures to identify solution to the problem. And then moving from 100 plus paper-based tool to 41 question. For me, it is something that I believe the community is appreciating being brought together to work. But then final thoughts from me is that for future and longer term engagements and successes, then adaptive mentorship is very crucial. As mentors, we need to adapt. As mentees, we need to adapt. So each time we do the mentor-mentee relationship, we really need to adapt to the changes, to the different realities, what is on the ground. And really personally, I want to appreciate the Kuhenza team for their honestly relationship, for their openness, ready to learn, available. We would all create time we would all be flexible to meet, and it really worked so well for me, and I believe for the team. So I really appreciate, and back to you, Lisa. Thank you so much.
Thank you for all of that, Khadija. Yes, we know it's a bi-directional learning, right? So, you know, one of the reasons we wanted to also highlight the mentors is because it's such a great learning process, and we know that implementing community-based initiatives isn't always just a one-way street, and there's so much learning in the community from mentors and from the organization implementing. So right now we're going to go to our next initiative, and then we're going to take questions. I see some of the questions popping up in the chat box. I'm really excited to have them addressed so please, teams, also look at the chat box so you can be prepared when I call on folks. So now, Strong Enough Girls Empowerment Initiative from Nigeria. We're excited. They are led by Queen and Omayale, and with their mentor, who is Chika Offer from Vaccine Network for Disease Control, based in Nigeria. So the Nigeria mentor and the Nigeria team. Over to you, Queen. We're very excited to hear about your Indigenous podcast series.
Thank you, Lisa. Hello, everyone. Good afternoon here from Nigeria. I'm joining you from Abuja, and I'm representing Strong Enough Girls Empowerment Initiative. We are a non-profit organization that seeks to improve the well-being of young people, adolescents, girls, and young people. Kate, do you mind sharing my screen? I have sent a message earlier. Sharing my slides, sorry.
Kate, can you please make a co-host?
Yes, I made you a co-host, Queen.
Okay, you should be able to
Can
share
you
now.
share my slide?
Yep, you should be able to share now.
No, I can't share it from my end. I want Kate to share them for me.
Okay.
I'm joining with my phone, so.
Oh, okay, Kate, do you want to go ahead and share that then? Great, and we're really excited to hear more. I've seen a lot on social media about you know your organization and some of this, so I'm really excited as Kate pulls up the slides. And I do notice, so we will get to the questions. See, Pamela, Laura's asking questions, as well as some others. It's great to see from people from all over the world too. So if you haven't introduced yourself yet, go ahead. Queen.
Okay, thank you, Kate. So our project was titled the Indigenous Podcast for Sexual and Reproductive Health. Originally, we launched in 2022. The first season launched in 2022. And with the funding from Core Group, we're able to launch the second season. In the second season, we trained 20 champions from across Nigeria. We published 19 episodes, and we did it in 5 Nigerian languages and also English. Next slide, please. Okay, okay, thank you. So the Indigenous Podcast is a multilingual podcast series that just wants to humanize the data around sexual and reproductive health challenges amongst young people across Africa. In the first season, we selected young people from Nigeria and the Republic of Niger, but in the second season, we focused solely on Nigeria. Next slide, please. And so these are the champions we selected in the second season. Next slide. And initially, we proposed that we would recruit young SRHR leaders aged 15 to 30 from underserved communities in Nigeria, specifically in Abuja or in the FCT. And when we implemented, we had to expand that age range to 35 so that we can include persons living with HIV and also persons with disabilities. We also initially wanted to have only an in-person training in Abuja for the champions, but based on the recommendation of our mentor, Madam Chika, and she shared with us the National Demographic Health Survey, and we saw that the SRHR issues are prevalent in several regions in Nigeria. So we had to adapt the training to a hybrid format. So we had an in-person training for those that were based in Abuja and a virtual training for champions joining from other states in Nigeria. We recorded and published, initially the plan was to record and publish 20 episodes on several SRHR themes and share across different platforms. But we finally ended up recording 19 episodes, and we also published those 19 episodes. Initially, we didn't include like an impact survey, but we had to do that after 5 months to understand the impact of the training on the champions. Next slide, please. And so for us, what worked was the hybrid model because we used it to include other champions that were not living in Abuja. We also had like a storytelling training for the champions where we were able to train them to identify their personal experiences surrounding HRHR and how to tell those stories to another person to elicit like emotion or empathy, or even as a way to advocate for those issues. We also had to ask some of the champions to record their podcast episodes in their local languages. That way we can reach young people who can't understand English. And then we conducted a post-training evaluation after the training and also like 5 months after. The challenges we have noticed so far is that we have low reach when we have low reach on Spotify, which is one of the platforms that we shared the podcast, and because it's an audio podcast, we are guessing that that is why there is low reach and people gravitate more towards video podcasts. But we had like at least the reach improved in on Instagram. And also another challenge we are facing is how to sustain the engagement of the champions beyond the project cycle. Although they are all in a WhatsApp group and we communicate from time to time, but we are looking at how to sustain the engagement. Next slide, please. So from the survey we conducted, we like 5 months after the publishing of the podcast and the training, 100% of the champions felt that they have become more confident sharing their sexual and reproductive health stories publicly, and 80% of them recorded like a higher SRHR knowledge, and also all of them are also advocating for SRHR issues in their community. And like you see, we've had like 1,000 plus listens on Instagram. We've also been able to amplify the podcast in the ICFP last year, and our abstract was also accepted in the upcoming FBCC Summit in 2026. Next slide, please. The key lessons we learned is that inclusion we should have inclusion in mind from the onset when we're designing the project itself. Like initially I told you, we have to expand the age to 35 as against 30. And also learn to use like a hybrid model so that we can include more geographical areas. And then we are looking at following up with an assessment in the next 6 months to see if there has been more impact from the project. And finally, I think one thing we needed to understand was that different platforms would have different promotion strategies. I don't think we factored that at the beginning. So going forward, we have to think through how we plan to promote the podcast on Spotify and also on other platforms. Next slide. And for sustainability, the one important thing is that the champions are all advocates and they continue to educate others post projects in their communities. The episodes are also live on our website, so anyone can have access to it at any time. We also would continue to conduct evaluation to support partner engagement and even donor management. And finally, continue to lend our voices in international conferences and summits. As for next steps, after discussion with our mentor, I think this was in January, she shared with us some contacts for to radio stations so that we can feature the episodes on radio to reach more people in local communities. We also are going to partner with her organization, Vaccine Network for Disease Control, to run paid ads on social media for specific episodes where we both align on. And then in a medium term, we will develop specific promotion strategy for all the platforms where we have published the episodes. And then on the long term, we hope to scale to other Anglophone African countries aside Nigeria and also publish a learning brief for dissemination widely. Next step, please. Next slide, sorry. This is just some pictures from our training and our in-person mentorship session with our mentor. Next slide. Yeah, and I think that's the end. You can find all our episodes on our website and the Instagram handle of the podcast. Thank you.
Thank you so much, Queen, for presenting this. And it's really great to hear about the local language communication too, and reaching communities through that mechanism. Chica, we'd love to hear from you as the mentor, what your reflections are.
Yes, thank you so much. I'm just moving my hand. I'm so excited. So the first thing, most of the work was done by Strong Enough Girls by Queen. So I was the first time we met, I was just in awe as to the kind of strategy, the kind of innovation that they have. And I really listened more than even added. I didn't really add too much. I just tried to see if I could just do a little bit of amplification, because I know that the idea of having the podcast is something that will be on the open domain in the social media for a very long time, forever. And that the kind of stories that they were telling were the stories that, that everybody wanted to talk about, but sometimes we're kind of afraid to talk about these stories. From the first episode, we're talking about the first period experience to the fertility scare and all the different kinds of things that we're talking about really, really touched me. And I knew that kind of conversation is the kind of conversation that should be on the social media. And based on some of the experiences which we also shared, we also realized that in many of the communities, even the rural communities, many people are on social media now, including Facebook. So this kind of podcast is actually the podcast that people can always refer to, listen to when they're facing this kind of different kinds of challenges. So I also supported the fact that they should use the DHS tool, NDHS tool, for information to actually be able to see which areas, which communities actually need what they have now. And what we discovered, many communities actually do need them. And then we also, we are very excited to work with Strong Enough Girls to be able to amplify what they are doing and also to work closely with them and government and the media. So with this trilogy of some sort, us, them, media, and the government, it will go very far. It will be a start of something new in the sense that people can actually say what they feel without showing their face and be real, and then people can listen to it and learn and gain, So I want to say that I feel very privileged that I was even selected to mentor such an exciting group, such a wonderful group, a very talented, innovative group. So first and foremost, I want to thank my core group for giving me this great opportunity. I think I learned a lot more than they gave to me. And with it, our collaboration, a lot of girls will gain so much. These are the kind of podcasts that should be shared in schools for teenage girls and things like that. So, and we're going to be working together to see how to scale it up in such a way and to start something that is going to be bigger than what we think. So I'm very excited to go further with Strong Enough Girls. I love the work that they're doing. I'm excited about it. I'm already raring to go, with them. And I know that this is just the beginning of many things. I just want to say thank you to Core Group for this opportunity. Thank you to Strong Enough Girls, because indeed they are strong enough. From the title to even the podcast, 19 podcasts. I know what it takes to even do one podcast. I know what it takes. And they did 19. I was very excited. And from each one, kind of questions, kind of things that they're talking about, are the things that are relevant, very, very relevant. I'm so excited. And I want to thank Strong Enough. I want to thank again Core Group for giving me this opportunity. And this relationship has just started. Thank you, and over.
Thank you so much. Yeah, thank you. Thank you so much. I mean, all of you are so inspiring, and what you're all doing is really doing the hard work, right? That not many people are talking about the power for girls and sexual reproductive rights issues and really giving a voice to that, or disability inclusion and finding those children at the community, or meeting the need of refugees and people that are living with disabilities that don't have access to sexual reproductive health. So you are all doing such amazing work. We're just so proud of you, and we recognize this was only a small investment in terms of money, and we're looking at other donors so we can turn it around and make sure that they know about your great work, so that you can do more just to help that scaling process. I want to get to some of the questions because I'm sure everybody who's stayed on really wants to hear more. So we'll start first with Laura Homeki. Great to see you here, and then move to Pamela Megara if you're still on. So Laura, if you want to come on mic, and camera if you want.
Sure. I'll turn off my video because I also am jet lagged. But hi everyone, and thank you to the Core Group for organizing the session. It's been very enlightening, and congratulations to all the presenters. I teach a course called Communicating for Public Health Impact at University of North Carolina, and a goal of our course is that students are able to communicate about public health to a variety of stakeholders with a variety of levels of health literacy. And I know a couple of the speakers talked about health literacy. I appreciate that the Core Group has the sign language interpreter for this webinar. So just would love to hear any of those who presented your thoughts on how you adapted materials for your different stakeholders with different levels of health literacy. Literacy first and then health literacy second. Thank you.
Great, thank you very much. So looking at health literacy and adapting as well as communication and adapt. Sorry. Who would like to go first? I know there was a lot of, you all spoke a little bit about this. Lucky, especially, I really loved hearing, the digital versus paper and some of the community, but who would like to answer?
Yeah, sure. We could take that, and maybe after this, our mentor could add something. But how we really looked into this, adopting what our tools to make sure that it was fitting people with different literacy levels. First of all, I think from what we shared, we really tried to shorten whatever we were asking from 141 questions to 31 questions. And our questions are also in plain English. We have really tried to remove all the difficult maybe words that could be a bit confusing for people. And also one part of it that we've really been working on, it's as at now, it's not complete, we are also translating this tool into Swahili so that it can be easier for community leaders who prefer Swahili as a language. I know in making such adaptation, we could also be looking into issues of maybe having pictorials, pictures for people to easily understand. But because we've been unable to do that in our paper-based, we usually have prior trainings with our community leaders on disability types, and we issue them a disability type guide, which has 36 types of disability that includes pictures. So if we are talking about cerebral palsy, they have already seen pictures on cerebral palsy. If we are saying it's impacting the left side, they are also able to see that, such that if I did not go to school, but looking at the pictures, when we are talking about hearing impairment, a good example would be, we have a funnel that we have drawn depicting the inner ear, the earlobe and all those things to show such a person that when we are talking about an infection, it could be on this part, and this is what could result to hearing impairment. So those are the things that we have really tried. And one other thing that we are really putting in place is having someone whose literacy level is quite low to be paired with someone with a higher literacy levels to support one another. But maybe our mentor could add more on that.
Yeah, thank you so much, Lucky. Just a quick one, and it may not probably be very specific to this engagement, but just sharing in other engagements how it has been done, which I'm really happy that, Lucky, you've talked about pictures. So what we have done is in other projects, we have used what we call illustrations, where you go to a community, use illustrations, and actually communicate using illustrations. So if it's an information about something, you draw and you use that information to actually make a meaning and make a sense with the community people to say whether does this really mean what you're actually saying, or if we use such illustrations with it, what is the message coming out, so that you're able to actually use illustrations to do that in the picture-based kind of communication. I have seen it working elsewhere, especially on the HIV adherence, HIV literacy, and treatment processes. Thanks.
Yeah, thank you for that. Yeah, sometimes the most innovative is the most basic, right? Going back to the basic: illustration, communication, talking. How about Queen or Olivia, Rebecca,
Okay.
Joseph?
Yeah, I would like to, okay, like I said earlier, we have to publish some podcasts in some local Nigerian languages, especially the major ones like Yoruba, Hausa, and other Nigerian languages, so that people in those communities will understand what the champions are saying. And then we also transcribe each of the episodes to English. So when you go to either Spotify or our website, you would see the English version, the written English version of all the podcast episodes, so that anyone who is hearing impaired can understand what is being said. Thank you.
Okay, thank you very much. I just wanted to add to that the beauty of it is that it's humanizing. The whole project is about humanizing the data, using storytelling to translate data. So, and then there's some of those stories that are very, very peculiar, like the first period experience. I read that one, and it's something that people at the community can come together and sit and have a conversation. And for many of us, it was traumatic. For many people, like people could identify with that, and that humanized that particular data and simplified that particular kind of data. Imagine having that in 5 languages where all these things are translated. So it had a way of bringing people together, sharing ideas together, sharing problems together, and also sharing solutions. So that is what I really got from this podcast. And the good thing, the most important thing that I want to add here is that now in many of the communities, most people use Facebook. Most people use some form of social media at the community level. And it's so refreshing to see that some of these stories will speak and help people to unravel some of the things that need unraveling. So for me, the humanizing of the data in those 5 Nigerian languages is key. And then looking at having to do further and also, humanizing in other languages. Nigeria has over 200 languages. So can you imagine people, maybe even if it's 40 languages, being able to hear the experience of others at different, those 19 podcasts. Very nice, very, very nice indeed.
Yeah.
Thank you, Anu.
Thank you. And how about Olivia Rebecca or Okoli Joseph from Diversity Innovation? Go.
Thank you so much. About us, the applications, we have used actually total communication in such a way that it has inclusion of sign language. The users who are using sign language out there, they're able to see or understand the content, but also we have been able to put basic communication for those ones who are interested in learning sign language. Once they tap on the videos, they're able to learn sign language. And also, if it isn't very clear, we have tried to embed pictorials that can easily align with the signs. For people who don't know sign language, we have also been able to add the captions in such a way that individuals who are unable to understand sign language, they can read and align with the signs that are taking place. So in other places where we have been trying to do lectures, we have been advised that we could add a background voice in our production so that individuals who cannot see, they can be able to hear. Additionally, we are trying to do, we are having inbuilt features, making it easier for persons who are deaf blind, who can't easily see. It can like, okay, for persons who are unable to see clearly, the pictures are bright enough for them to see. The font sizes could be broader for those individuals to visualize the content. Yeah. Thank you.
Thank you so much. I know I learned from diversity innovation. I wasn't aware of so many levels of sign language variation. And so thank you for that.
And if you me just to add on, it has been a very important platform because actually it, of course, the app help person who have difficulties in hearing or who have hearing impairment. But actually, because it has what Olivia has referred to total communication, even people who have dropped out of school, who have a lower level of literacy, it was extremely useful. And also it helped us break up the first communication barrier, which is basically attitudinal barriers. So when people can actually start to dialogue, communicate to each other, actually it does not really matter whether you understand sign language. When you are a health provider, you can still provide health to person with disability, because I think we all know here, whenever we speak about disability, how do you care for a patient with disability in a health setting? The first answer from the health worker will be always, the problem is we don't have sign language interpreter. Whereas actually they can do so much, and there are also so many different public that they can care and treat. Thank you.
Thank you, Marie-Ange. Yeah, very, very important. I'd like to first, 1 second, Chika. I'd like to go to Pamela Magaro, who's waited for her question, and then we'll go back to Chika. Pamela, do you want to come off and ask your question? Okay, so I'll read it. In terms of, this was to Cohenza for children. in terms of what are the different modules in the case management tool?
Okay, thank you. So our mobile application is made up of different modules depending on the type of user. So we have the child registration, child staff assignment, local leader assignments. We have intake, progress, and exits. We also have applications and agreements, leader biannual check-in, all-purpose counseling forms, follow-up forms, expenses, and also we had a module on food relief. But for this particular project, we were focusing on the local leader biannual check-in. This is the extension which most of our community leaders work on. The other modules are all used by staff for the other part of our case management.
Thank you for that. Chika, go ahead.
Oh, thank you very much. I just wanted to say I was asked to introduce myself. I forgot to introduce myself. I was so excited about what we're talking about. So my name is Chika Kemi. I'm the CEO of Vaccine Network for Disease Control. So we believe that anything that supports development is a vaccine, and anything that disrupts development is the disease. A women-led organization, and we focus on women and children. And we believe that women are the missing link, and without women, nothing happens. I just wanted to put that on the table because Kate has been telling me to introduce.
Absolutely. Thank you very much for that. So I have a question for you, this last question for everyone. And when you're thinking about all of your projects and the time and effort and the passion you put into it, the strengths, the weaknesses, the challenges, and everything you've had, what's been the most significant thing for you that really you're proud of? Like, you're proud of X. What is that?
Yes.
What's really struck home for each one of you?
Yeah. So I want to say, for me, what really struck home was that when I watched the podcast, those were pending questions that a lot of young people, even I, when I was young, was a great issue. My first period, how did it feel, and all that. All the questions were very, very important questions. Choosing safety over fear, having to take certain decisions. And what touched me was that all these things came to the fore by young girls. So it's something, and immediately what just came to my mind was, if this podcast goes very far, and I will try my best with support of partners to make sure that it does. Many people went through what I went through as a young person. We get first-hand knowledge that it is not you alone, and these are things that happen to everybody. For me, that expose, that ability to be vulnerable, the girls were all vulnerable, and when it just spoke to my heart to come out there and show this vulnerability. I think for me, that's just what spoke to me. And the kind of questions that I was afraid to ask as a young person.
Thank you, Chika. Yeah, thank you. Let's hear from our implementers. So Queen, how about you? What was the most meaningful for you?
I think I would say I echo what Madam Chika has said, but I would also say that I realize how much difference it can be to put something down on paper and implementing it in real life. So mentorship in this instance really helped us see through all our plans, like where we were missing certain things. For instance, the hybrid training. Initially, we had set physical, and we would have missed out on young people in other communities if Madam Chika had not highlighted that national demographic health survey. So just the collaboration with our mentor and just her practical advice really helped us. Thank you.
Thank you. Over to diversity innovation. What's been most meaningful to Olivia, Rebecca, a colleague Joseph, Marianne?
Okay, thank you so much. It's a very wonderful question. Me and my colleague have got responses. First of all, me as Joseph, most importantly, I feel the health system has many challenges. But coming up with this particular innovation makes me feel so proud, because the innovation itself is looking at persons with disabilities and solving a problem or challenges that a country is facing currently. So the innovation makes me very proud that it is solving a problem that the country has at the moment, and the problem which is affecting our communities. Rebecca, in addition to that, it's real life experience that I've faced myself. I'm very happy that these funds have supported us to implement this particular project. This uploading of these videos has honestly been a good thing, that many persons with hearing impairments out there were so happy having got to learn about this knowledge, and it has helped individuals positively and impacted them. Secondly, I'm very happy that this has given me an opportunity to be mentored by Marie, who has supported me and the entire team to get this experience all through. Thank you.
Rianche?
I think what I'm the proudest for this year is really when we were able to train the teleoperator from the Ministry of Health, who are receiving callers and the whole day about health emergency, as well as information on health, or they want to actually file a complaint to the Ministry of Health. And Rebecca and Joseph was able to be with me and to present the app as an alternative to get like really inclusive information on health. And it's also help them to understand what are the challenges of persons with disability when they are calling such an important number as Ministry of Health. Thank you.
Excellent. Lucky, Thomas, and Khadijah, over to you. What's been most meaningful?
Thank you so much for the question that you have asked. For us, what we have seen it meaningful with our project is that we have been able to engage the community leaders with low literacy or low digital level to be able to use this tool that we have developed to reach children or families with disabilities. And in that case, those families have been able to get the desired services. We have also seen that through these projects, or by working with the community leaders, the families that we have intended to reach them with our services, we have been easily, or the community leaders have been able to identify them and to refer them for the required services. Something that I could not be possible if it were not the engagement of these community leaders. So we have seen that all the community leaders, even those with low literacy level, they have been able to provide services in their communities where they live.
Yeah, maybe to also add to that, the fact that we were able to streamline this form from 141 question to 31 was, for me, it's quite a big win for us, because it has also informed the other modules that our staff are working on. And I believe it will also be reducing the unnecessary information that we were really trying to bring on board and focus on what is important for us to support these children with disabilities.
Khadijah?
Yeah, thank you so much, Lisa, and the team. So for me, I'll just speak about this particular program area that core group is really championing. So for me, I think if we are to realize local leadership, if we are to build capacity of local, stop importing solutions. I think for me, this mentorship is something that core group should continue. Either way, whether identifying mentors for local organizations, with or without seed grants, but I think this relationship is really, really valuable. And I think we can actually see from the results that we have had from the rest of the team member. So for me, this is something that is really striking. And an advocate for local leadership, I think let's continue to sell this idea to other organizations, other platforms, so that we provide a pool of mentorship for local organizations so that they're able to, build their capacity to deliver beyond the expectations.
Yeah. Well, thank you all for those that attended. I also like to once again thank Kate Kabore, who's been the liaison in our comms and advocacy that's trying to promote all of you and your great work. We will continue to look for funding to help scale and also introduce you to other donors and offers if possible. And I'd just like to thank you so much for your incredible work. My heart is full listening to all of you and the great work you're doing. And we really aim at Core Group to promote this and to bring the civil society voice forward, the work that you're doing, and to make those connections. So thank you, Lucky, Thomas, Khadijah, Chika, Queen, Marie Ange, Rebecca, Olivia, and Joseph. Thank you. And to our trusted translator, Bumsa, thank you so much. We're just so wonderful. It's wonderful for you to be here, and we will have the video available for others to watch. So thank you very much. Congratulations to all of you. And please stay in touch at coregroup.org. Sign up for our listserv and find out the new news, the next pitch challenge, and more of our convenings. Thank you.
Thank you.